Greetings. I'm Hugh Thomas, and I'm proud to be the 16th Dean of Tufts University School of Dental Medicine. I'm here with former Dean Lonnie Norris to share some of the highlights of our history.
For 150 years, we've been a leader in education, clinical training, and research, graduating professionals who provide quality oral health care to communities all over the United States and the world. Our success didn't come overnight. Rather, it developed from more than a century of hard work, building and refining our program from its humble beginnings. As we commemorate our achievements and look toward the future, we wanted to reflect on the legacy of our mission at Tufts University School of Dental Medicine. From the beginning, Tufts Dental has always been about people. Pioneers in the field have helped make us a world-class institution. In 1868, Dr. Isaac J. Wetherbee, a minister and self-taught dentist, opened one of the first dental schools in the country. He called it the Boston Dental College. In 1899, the Mass State Legislature empowered the institution, which had just changed its name to Tufts College Dental School, to award a doctorate of dental medicine. By 1912, Tufts was the 12th largest dental school in the United States. As we grew, Tufts School of Dental Medicine made a commitment to community and diversity. Dr. Mary Crutchfield, one of our first African-American female students, became one of the first black women to open a dental practice in the Boston area. For years, she ran a children's clinic out of her home in nearby Cambridge. Dr. Crutchfield later worked for the Boston Dispensary and volunteered with the Mississippi Health Project. Tufts has promoted cutting-edge research for generations. In 1932, one of my predecessors, Dean Howard Mitchell Marginson, who was also a Tufts alum, pushed for the development of a strong research program. Dean Martinson's successor, Dean Basil Bippy, recruited faculty who encouraged students to be innovative in practice and research. Among them was Dr. Irving Clickman, another Tufts alum.
Clickman brought biology into the curriculum. He did oral medicine, and he changed the tenure or texture of the place because biology came first, and before you put any restorative work, your biology, your gums, your oral condition had to be correct.
Other Tufts alumni pushed different boundaries. Dr. Esther Wilkins was one of the 3 women to complete the Tufts Dental program in 1949, at the time when less than 2% of the practicing dentists were women. After graduating, Dr. Wilkins played a key role in establishing the dental hygiene program at the University of Washington, where she wrote one of the first comprehensive textbooks on dental hygiene.
The book came about primarily because every time we had a new subject come up, I'd say to the students, well, now, there isn't any book about this, but I have this handout for you. It made a collection of handouts which began to pile up, like this. So one day when the person from the company came to see me, and he took it down, the whole pile of papers, and reading, sitting there, like that. We should publish this, he said to me, out of the blue. And I said, that's a good idea. I didn't know what to say.
Tufts graduates are trained according to the highest standards of ethical and clinical practice, and while at Tufts participate in a variety of community-based activities. Our alumni learn as students the importance of engaging in the community as both clinicians and citizens.
As an independent private institution, Tufts has attracted students from around the nation. After graduating, they have gone on to serve patients and communities in Boston, New England, around the country, and throughout the world. Our alumni have helped to enhance our international reputation for professionalism and care.
Dr. Kathleen O'Loughlin graduated from Tufts in 1981, where she was the first female class president in the school's history. She later became the executive director of the American Dental Association. We believe that the best way to send skilled clinicians into the world is to provide them with a strong sense of community and history while they're here in Boston. Take, for example, Drs. Jamie Diamond Golub and John Golub, who met at Tufts School of Dental Medicine.
My first externship was to Alameda, California, and we had students from Columbia and NYU with us. And not that they weren't prepared, but our Tufts group got together and said, wow, we really know our stuff. And we were doing that as juniors or third-year students, while the other schools had fourth-year students. But we just felt really rock solid prepared.
A lot of the lab work we had to do on our own, which just made us so aware of what was going on inside the mouth. And it just developed the skills, the eye-hand coordination, like I feel a good dental school should.
Now, John and Jamie's 3 sons, Mike, Zach, and Ben, are also Tufts dental students, carrying forth their family's commitment to their patients and the profession.
I see the relationships that my parents have built with their classmates, and even the relationships my older brother, who's a third year right now, has. And I don't think you can really quite beat that. They're very close, they refer patients to one another, they work with each other, and just in the first couple of weeks of school right now, we're already starting to develop these close relationships with our classmates.
At Tufts, members of our faculty and staff commit themselves to providing quality, one-on-one time with their students. Our team works with each student, instilling the core values and skills that make great dental professionals. At Tufts, our commitment to people, patients, research, and community has developed over 150 years. With the work that they do and the gifts they have made to this institution, our alumni and friends have made all this possible. On the occasion of our sesquicentennial, we invite you to celebrate what you have accomplished and what we have achieved together. Help us transform the gift of our legacy into the future of our profession.